Welcome. Thank you for your interest in the Reshape procedure. Reshape is a non-surgical, proven weight loss option that we are excited to be able to offer our 30 to 40 BMI patients. We are seeing great results with the Reshape procedure, and patients love it because it offers a complete solution to help you lose significant weight and keep it off. Let's get started. I'm going to tell you all about the Reshape procedure. We'll start with a quick discussion about obesity and how being obese can affect your life. Then we'll talk about the Reshape procedure and how it can help you achieve life-changing weight loss without surgery. We'll also explain how you can get started on your path to weight loss. Let's begin by understanding what we mean when we talk about obesity. Obesity is widespread in this country. We assess obesity using a measurement called BMI. BMI is calculated by using your height and your weight. A BMI between 18.5 to 24.9 is considered a healthy weight. BMI between 25 and 29.9 is classified as overweight. A BMI over 30 is considered obese. You most likely fall into this category of mild to moderate obesity with a BMI of 30 to 39.9. This means that you are not considered morbidly obese with a BMI over 40, but you are in a weight category that puts your health at risk and can impact your quality of life. So how can obesity, even mild to moderate obesity, impact your health? Being obese can put you at risk for a number of conditions or diseases, commonly referred to as comorbidities. Prevalent comorbidities include one or a combination of those listed on screen: heart conditions, diabetes, stroke, high blood pressure, high cholesterol, osteoarthritis, and many types of cancer. In other words, we see higher rates of these conditions and diseases in people who are obese. By losing weight, we greatly lessen our risk for these health issues and, in turn, lower our medical costs and can extend and enhance our lives. In this video, you'll hear from real Reshape patients about their experiences and outlook before they lost weight with Reshape. As you watch the video, you may want to note if there is anything you can relate to. Also, think about how your weight impacts the way you feel and your outlook on life. Then, think about how you'd feel if you were able to lose weight. How might you think or feel differently?
I was tired when I got home, and I didn't want to participate in my family's life. And that makes me sad. I feel like I missed out on a lot of things.
I was tired all the time, sluggish, groggy, short of breath. Certain things were hard to do. I couldn't exercise as long as I wanted to. I would feel tired after climbing a flight of stairs.
It was uncomfortable to tie my shoes and couldn't do some of the athletic things that I wanted to do. I'd be winded a lot.
I pretty much ate a lot of fast food. I didn't exercise on a consistent basis, and it showed too. The weight kept slowly coming on.
I was just a miserable person. And when you get into that misery syndrome, you feel sorry for yourself and you feel like everyone's picking on you about your weight. And I got to where I didn't even want to leave the house.
There are many factors that cause us to gain weight. Your weight and how quickly and easily you lose or gain are determined by genetics, whether your parents or other family members tend to gain weight, and whether you have a naturally high or naturally low metabolism. Diet, what you eat, how much you eat, and how often, your fitness level, and your lifestyle. It's easy to gain weight as a result of any one of the factors listed, but it's rare that just one is impacting you. Often, multiple factors come together and impact our weight. That is why it's so challenging to lose weight on our own. Most of the time, we will focus on one area of weight gain without looking at all of the contributing factors. There are a number of weight loss methods that have been available. You may have even tried one of these options. Most of the patients we see have tried at least one, and sometimes all, of the methods listed here. The problem with traditional diets is that many of them fail for a number of reasons. Often, they may rely solely on your own willpower. And when willpower falters, there's nothing to keep you on track. They are too restrictive and are not sustainable for the long term. If you can't stick with it for much longer than a few weeks or months, it's not going to keep you on track for life. Some methods only target one particular element, such as eating or exercise, but we already know that multiple factors influence our weight. You've probably heard the statistic that 95% of people on diets fail. But think about it this way. 95% of diets fail people. And that is where the Reshape procedure comes in. Reshape helps counter common problems people face with traditional weight loss methods by providing a pathway to achieve portion control and maintain permanent lifestyle changes, leading to life-changing weight loss. The procedure includes new dual balloon technology to safely limit the amount of food you can eat. As you can see in the illustration, the balloons sit in the stomach, taking up space and providing built-in portion control. You also receive a year of comprehensive coaching, during which you'll meet every month with our amazing team to talk about how to make healthy living, fitness, and nutrition a permanent part of your life. By combining the balloons and the coaching, Reshape helps you get real, lasting results without surgery. In Reshape's FDA clinical study, patients lost more than 2 times more weight with Reshape than with diet and exercise alone. And most study patients kept the weight off or continued to lose more weight during the 6 months after the balloons were removed. The Reshape procedure is divided into 3 phases. We'll go into each one in detail. The first step is the readiness phase, which begins before you receive the balloons. Our goal during this phase is to review your health history, lifestyle, and expectations to confirm that Reshape can help you achieve the kind of life-changing weight loss you're looking for. We start to prepare you for the year ahead and introduce the program components that will help you succeed. You'll also meet the coaching team, who'll support your efforts over the course of the procedure. Everyone on the coaching team is highly qualified and has extensive experience helping patients implement changes that will support weight loss for life. The second phase, called Jumpstart, begins with the insertion of the Reshape dual balloon device. The balloons are inserted endoscopically in an outpatient procedure by one of our highly qualified physicians. After 6 months, the balloons must be removed. This animation shows how the balloons are placed in the stomach. Reshape's unique dual balloons are inserted by a highly trained physician in an outpatient medical setting. The procedure lasts about 20 minutes. During the procedure, the patient is comfortably sedated under light anesthesia. An endoscope is used to insert the balloons through the mouth, down the throat, and into the stomach. Sterilized salt water, called saline, is used to inflate the balloons. Once the balloons are inflated, the endoscope is removed and the insertion procedure is complete. The balloons remain in the stomach for 6 months. After 6 months, the balloons are deflated and removed during a similar endoscopic procedure. Both the insertion and removal procedures are non-surgical, require no incisions or permanent changes to the digestive system, and may be completed in an outpatient environment. During this time, it's common to have mild to moderate side effects that include nausea, vomiting, bloating, and cramping. This is due to your stomach getting used to the balloons. We can provide a prescription for medications that can help calm these feelings. This adjustment period usually takes a few days. We recommend you take a few days off from work, and then after that adjustment period, you should be able to return to regular daily activities. The balloons help patients achieve such great results because they limit how much you can eat, And because they fill your stomach, you'll still feel full and less hungry. After the balloons are inserted, it may take your body a few days to adjust. You'll start by introducing liquids, then purees, soft foods, and finally normal foods to give your stomach a chance to adapt to the balloons. In this video, you can hear from patients about the balloon insertion and what it feels like when the balloons are in your stomach.
The discomfort after the Reshape balloons were implanted was, I knew that they were there. I could tell that they were there, and I did have a little bit of nausea and vomiting, but it was nothing that was unbearable. It was actually just a few days, and then I was right back to work.
In the beginning, it was a little uncomfortable. I was not able to eat solids for the first week, but as time went on, I couldn't really feel them at all. They definitely helped make you feel fuller, faster, less food.
Reshape was different for me because I had a sense of fullness as soon as I ate enough. As soon as I was done with that last bite, I mean, you are full and you don't want any more, and you're full for a full 4 hours.
When I got the balloons in, I did not feel hunger. My stomach was full. I was able to eat small amounts and enjoy those small amounts, but I did not feel hunger.
While the balloons are a very important component of successful weight loss with Reshape, they are only part of the story. The other core component of Reshape is the personalized coaching you receive. As we mentioned before, you receive 1 full year of personalized coaching. You'll start meeting with your coaches prior to the balloon insertion. Afterwards, you will come into the office every month and meet with your team. We will check your weight, review your food choices, and evaluate your fitness activities to see how you are progressing. We'll also talk about what's been working well for you. We'll figure out solutions to your challenges and help you make changes and set goals that are realistic and attainable for you. To help you get started on the right foot, you'll receive the Reshape Patient Starter Kit. The kit includes a binder with in-depth information about the Reshape procedure, a patient information guide, and a portion control plate. The binder is complete with comprehensive instructions, frequently asked questions, and useful tools. The patient information guide provides important information about the procedure and what to expect. And the portion control plate makes eating and measuring the right portions easier from the beginning. To accompany the coaching, you will receive access to an online Reshape patient portal. The portal is accessible once your procedure has been scheduled and is packed with tools and information that can help you be more successful. You can access the Reshape patient portal online or from your smartphone or tablet, and it will let you send us a progress report before your appointments that we can review together. And to encourage you to use the portal and access the resources, Reshape runs regular contests through the portal, so you can win prizes and gear just for logging in. When you use the portal, it tracks your progress over time, so as you lose, you'll be able to view charts and graphs that show all of your success. The healthy living phase is designed to help you stay on track and continue your weight loss. A lot of patients are worried about what will happen after the balloons are taken out of the stomach. They are worried that without the help of the balloons, the weight will come back. That's why we continue the procedure with an additional 6 months of coaching. During this time, you continue to meet with your team, and you'll make a plan to stay on track, maintain the weight loss, and continue to make progress to reach your ultimate goals. The healthy living phase will help you maintain your weight loss by continuing with another 6 months of healthy eating, fitness, and personalized Reshape coaching support. Here, Reshape patients can tell you about their experience after the balloons were removed.
It's been almost 2 years now, so I'm looking at life in a whole different way. I'm happy again.
You know, you learn to live a different life. You learn how to correctly eat and kind of pay attention to what you're putting in your body. And
The exercise. You wouldn't have caught me running, jogging, none of that before I got it. And now I can run 2 miles and be just fine.
It motivated me to work even harder with the exercise and stay on the program of losing weight. And even after the program ended, I continued to work out. I continued to watch what I eat, and it's just been really amazing.
After Reshape, my life has been better than I ever expected. And I've had some trials in my life since then, but I'm so happy that I have been able to face them with a healthy body.
We've had the opportunity today to review the Reshape procedure and explain why it is such a great option to help people like you achieve life-changing weight loss. To wrap up, here is a summary of everything you'll receive when you sign up for Reshape, which includes the balloon insertion and removal procedures, 1 year of coaching with our expert team, access to the Reshape patient portal throughout and after the 12-month program, a starter kit with a program overview binder, and a portion plate to get you started eating smaller meals. The value of the Reshape procedure goes beyond the jumpstart with the dual balloon and monthly coaching. It provides you with tools to change your behavior to help achieve lasting weight loss results. As with any medical procedure, you may have questions about Reshape. Listed here are commonly asked questions about the Reshape procedure. To get the answers to these questions and to learn more about Reshape, please visit the Reshape website at www.reshapeready.com or talk to your doctor. Thank you for your time today. We are really excited about the Reshape procedure and the benefits for our patients. To get started with Reshape, schedule an appointment today. We look forward to talking with you and getting you started on your path to weight loss.